In this module, we will focus on exercise and movement and how they affect health outcomes. These are the questions from the behavioral inventory we will go over in this video. I sit for 8+ hours per day. Having a sedentary lifestyle can increase your risk of premature death. When you're in a seated position for a long period of time, there is no physical stress being put to the body, which can lead to several different health consequences. People with sedentary lives tend to be obese, diabetics, or have some sort of cardiovascular issue. Commonly, these people tend to be affected by comorbidity, which means there are additional health conditions happening at the same time with the primary condition. Other consequences include a weaker immune system, depression, and anxiety. Being active, on the other hand, promotes improved blood circulation and bone and muscle strength. This in turn lessens the risk for various chronic diseases relating to metabolic syndrome. If you're a sedentary person or spend most of your day sitting in the chair or on the couch, there are ways you can reduce the amount of sitting. For instance, you can take breaks, set reminders to get up and stretch approximately every 30 minutes, or work in a standing position. All these will reduce the time spent sitting and is a step in the right direction to lessen the health risks associated with inactivity. I currently have a labor-intensive day or job. Working in a labor-intensive occupation has its pros and cons. The potential benefits of working labor or having a laborious day is that you're most likely not sitting for a prolonged period of time. Most importantly, it promotes physical activity. This comes with a reduced risk of several forms of cancer, such as colon cancer, prostate cancer, and endometrial cancer. This also reduces the incidence of cardiovascular diseases, such as coronary heart disease and ischemic stroke. In most cases, the association between occupational physical activity health outcomes are not different from that of leisure activity. However, high occupational physical activity is associated with some unfavorable health outcomes when performed excessively. This includes a higher all-cause mortality from accidents and poor working conditions, osteoarthritis from repetitive and overuse movements, poor sleep quality and curation, and even mental health illnesses such as depression and anxiety. It's important to practice safety habits in the workplace or just about any situation involving some form of physical activity and exertion. Some examples are taking breaks and staying hydrated. Our bodies need to replenish energy and to have time to recover so that we don't feel fatigued or pass out. Being aware of your surroundings is important as well, especially when lifting heavy objects or when you're in a potentially hazardous area. Wearing personal protective equipment, or PPE for short, should also be considered. This includes wearing a helmet when riding a bike, gloves when working with sharp objects, or putting on sunscreen when going out in the sun. I average at least 7,500 steps per day. Averaging 7,500 steps a day is a great concrete goal that follows the physical activity guidelines and that you can strive for each day. It is the optimal number of steps that is associated with indicators of good health and a decreased risk of chronic diseases due to the reduced body fat and blood pressure. According to a study conducted in the US, the average person has a step count of about 5,000 each day. Having a step count of less than 5,000 is categorized as sedentary, and anything above that is categorized in a continuum of activity levels. Therefore, it's important to partake in activities that promote walking to achieve an average of 7,500 steps. While 7,500 steps may sound like a lot for someone who isn't all that active, it's important to start small first and then build your way up each week. For example, you can start with 1,000 steps the first week, then progress to 2,000 the next week, and so on. If one long walking session doesn't work for you, you can break it up by having morning walks, midday walks, and evening walks. Also, the steps do not necessarily have to come from walking or running alone. It can be something routine, such as taking the stairs instead of using the elevator, walking instead of driving the car, or parking your car very far. Adopting small behavioral changes like these will help contribute to your steps goal without having to go out on a walk or a run. I engage in consistent and regular aerobic exercise. Aerobic exercise comes with several positive health outcomes. It's been shown that cardio decreases mortality rates across all populations. Aerobic exercise can lower incidences of various forms of cancer, including lung cancer, kidney cancer, breast cancer, and stomach cancer. It also helps reduce metabolic diseases such as hypertension, diabetes, and dyslipidemia. Aerobic training can assist in maintaining bone density, thus preventing osteoporosis, reducing fractures, and alleviating arthritis. Your muscles will become better toned with aerobic exercise, which leads to reduced musculoskeletal pain, as well as aid in the rehabilitation process for injured patients. Sleep quality is improved due to the reduced time it takes to fall asleep, less awakening, increased deep sleep, and less daytime drowsiness. This, in turn, improves cognitive function, memory, concentration, and learning ability. Lastly, aerobic training may also decrease risk of mental illnesses such as depression, acute and chronic anxiety, and stress. The physical activity guidelines recommend doing at least 150 to 300 minutes per week of moderate intensity aerobic exercise or 75 to 150 minutes per week of vigorous intensity aerobic exercise, or an equivalent combination of moderate and vigorous intensity aerobic activity. A general rule of thumb is that a person doing moderate intensity aerobic activity can talk but not sing during the activity. A person doing vigorous intensity aerobic activity cannot say more than a few words without pausing for a breath. Setting SMART goals can be very useful as it allows you to create goals that are specific, measurable, attainable, relevant, and time-based. This ensures that the goals are not vague and unrealistic, but rather carefully planned out, clear, and trackable. A common mistake beginners make is that they make goals that are poorly made, making them daunting and unachievable. In general, beginners should start at a lower intensity the first week and then increase the minutes of exercise or intensity the second week. Here are some examples that can fall under aerobic exercise. These include walking, gardening, cycling, jump roping, and swimming. Some of these activities are more accessible than others, such as walking, because you do not necessarily need a gym membership to walk or jog. You can simply walk outside around your neighborhood. Or if you don't want to leave your house, then jump roping can be just as effective as jogging in burning calories. Aerobic physical activity is not limited to just these. Any activity that increases your heart rate and breathing can be considered aerobic physical activity. I do muscle strengthening activities 2 or more days a week. Participating in resistance training can provide additional benefits not found in aerobic activities. Strength training will help reduce risk of metabolic diseases such as type 2 diabetes, hypertension, high LDL cholesterol, which is the bad cholesterol, and high triglycerides. Muscle training will increase your levels of HDL cholesterol, which is the good cholesterol in your body. About 1 to 3% increase in bone mass density can also be seen, and this is especially important for individuals with osteoporosis or with a family history of osteoporosis. Resistance training can also be beneficial for individuals experiencing low back pain. Muscle mass can be maintained during weight loss and thus increases lean mass to fat mass ratio. The physical activity guidelines recommend doing one set of 8 to 12 repetitions to the point of discomfort. You should focus on the major muscle groups, which are the legs, hips, backs, chest, abs, shoulders, and arms. Each muscle group should be trained twice a week. There are several different ways in which you can adopt strength training activities. Exercises can be performed using machines, free weights such as dumbbells, barbells, and medicine balls, and even your own body weight. Bodyweight exercises offer the most convenience because you can perform them at the comfort of your own house. Other alternative forms of bodyweight exercises include yoga and tai chi. There are several videos on YouTube on how to perform certain movements and exercises for each muscle group, and they can be useful for beginners. And here are just some examples of different exercises for each major muscle group. I stretch at least 2 to 3 times a week. Stretching is another important aspect of physical health outcomes. Not only does it help improve your flexibility, but it also helps prolong independency throughout aging. When you get older, your muscles naturally tend to become stiffer and will result in musculoskeletal discomfort as well as a reduced range of motion. It's recommended that you stretch at least 2 to 3 times a week. Some benefits that come with stretching include reduced risk of musculoskeletal injury, improved range of motion, a greater sense of strength, and a higher efficiency in muscle function. Lack of stretching may result in tightened muscles and compacting joints, as you may have seen in older individuals with a hunchback posture. Consequently, shortened muscles and poor posture can lead to pain or discomfort in the affected area. You can add a stretching routine at any time of the day, such as after waking up, before going to bed, or before or after exercising. One thing to note is that you should be stretching to the point of discomfort, but not to the point where you feel pain. There are two main types of stretching activities. One is dynamic stretching, which helps warm up your body before an exercise session. This helps increase blood flow and prepares your muscles to mobilize for your workout. Dynamic stretches include jumping jacks, high knees, and arm circles. Another form of stretching is static stretching, which is good to incorporate to your cool downs after a workout. This can be useful to increase long-term flexibility of your muscles. These include hamstring stretches, side stretches, and thigh stretches. And here are the references I used to gather information for this module. Thanks for watching, and I hope you learned a lot about exercise and movement.